I'm Dr. Karmon. I work at the Fertility Institute of Hawaii, and I spend a lot of time talking to patients, making educational materials, videos, trying to educate patients, trying to help them get through their treatments in various ways. But I really would like to share my own story about recurrent pregnancy loss, and I hope that what I'm about to share helps some people understand that they're not alone, and helps them to understand that there is a way to get through their experiences. The first time that I got pregnant, I was probably around 30 in residency, and it was a great pregnancy. It was really easy. I didn't have any problems. I would skip my prenatal care. I was a busy resident on the labor floor, and my supervising attending would say, Anatte, I haven't seen you in the clinic for a while. Why don't we check your blood pressure, make sure everything's okay? And I was always like, everything's fine. I'm so young and healthy. I'm perfect. My baby's perfect. What could ever go wrong? And I was right. Everything went fine. I had no problems and had a wonderful, healthy delivery and baby. And that's the way I want every pregnancy to go for everyone. And then continued with training, and I decided that I wanted to have another baby. So we started trying, and thankfully I conceived, and I sort of felt the same way. Of course, I was a few years older, but I felt like everything would be fine, and still felt young and healthy. And this is kind of where it gets hard for me to talk about. I ended up, for whatever reason, just deciding to do an ultrasound in the clinic. I was probably around 10 weeks along, and so I acrobatically did an ultrasound on myself in one of these rooms right here, and there was no heartbeat, and the feeling of that was surreal. And I have told patients that their fetus had no heartbeat thousands of times, and I could not have prepared myself for that moment where that had happened to me. And I knew what it meant, and I knew it was true, but I still had somebody else confirm it for me, and I still had this hope that maybe I was wrong, even though I knew I wasn't. And so that was really one of the first times in my life where I felt almost mortal, and I went from being sort of this happy, healthy young person to something else altogether. And so that was hard to get over, but I made it through, and I listened to my own advice, and I told myself that miscarriages are common, and it's unlikely that this will happen again to you, but I conceived on my own again, and I was so nervous and so scared that the same thing would happen again. Everybody told me, you're crazy. There's nothing wrong with you. Nothing wrong with your baby. What are the chances? And of course, every day was a struggle, and the same thing happened. I had another miscarriage, the second one in a row, and that really changed me forever. There were a few takeaways from that time in my life. First of all, I can safely say that was the worst time in my life. It's something that I didn't feel comfortable talking about with other people. Typically, when you get bad news, you have people there to support you, of course, depending on what it is, but with miscarriage, we don't really feel comfortable talking about it because it's such a personal and private matter. Very, very difficult to really open up to people, and sometimes when I did open up to people and sort of just would even have these outbursts of sadness, I think people didn't know what to say. It almost felt like everybody always said the wrong thing. People would say, you'll be fine and this isn't going to happen to you again. But look, it just happened to me twice, and how do you know everything's going to be fine? And I'm a fertility doctor. I know that things could never be fine. It just made me feel like there was really something wrong with me, that I was unhealthy, that I went from being this perfectly okay person to somebody that wasn't fit for reproduction. And that feeling is something that still sticks with me. After that, I got all those tests done, all the tests that I recommend to my own patients. This time the pregnancy was successful. But every day of that pregnancy was so different than my first, because it was this fear, that this discomfort that I knew something bad was going to happen. Even after the first trimester, I would just lie awake all night thinking about all the terrible things that could go wrong. And it was just, every day was such a struggle for me. Even in the delivery, it's like those miscarriages that I had just ruined this healthy pregnancy for me. And having those miscarriages, they really stole from me what should have been such an amazing time and such a good experience. And I just want my patients to know that when they feel that way, that's normal, and that there are treatments, there are things that we can do to get through this. There are people to talk to, and there's a way to get through it. And then don't let, those past experiences steal from the present and future you. For those of you who might find this story to be familiar, and for those of you who've experienced one or more miscarriages, please do see a doctor. There are a lot of treatments, a lot of things that we can do, and we can help you figure out what's going on, we can help you conceive, and we can certainly help you not feel so alone.